Hello, Azan. I'm Dr. Jane Miller, hepatologist. Today, quick, practical tips to protect your liver. I'll explain 5 foods to avoid and simple swaps your liver will thank you for. Subscribe to Health and Wellness for All for weekly liver health advice. Same model, same set. Let's go to the video.
If you want your liver to keep doing its heavy lifting, cleansing your blood, storing energy, metabolizing nutrients and medicines, you should know which everyday eating patterns consistently appear in the research as harmful when they become regular habits. Doctors and liver specialists aren't interested in scaremongering. They point to real, repeatable mechanisms that link certain common foods and products to fat accumulation, inflammation, and even long-term scarring of the liver. Today, we'll cover 5 of the highest priority offenders clinicians warn patients about, what they do to the liver, the evidence behind the worry, and practical swaps that actually move the needle. Number 1, alcohol. This is familiar, but it bears repeating. Alcohol is a toxin the liver must neutralize. Ethanol is converted to acetaldehyde and other reactive molecules that cause oxidative stress, damage cell structures, and provoke immune-driven inflammation. Repeated injury, followed by repair, leads to scar tissue, fibrosis, that can progress to cirrhosis and liver failure. Alcohol-related liver disease remains a leading cause of liver-related deaths in many countries. And for people with existing metabolic risk, obesity, diabetes, or fatty liver, even moderate drinking can accelerate harm. Clinically, alcohol is the clearest and most direct cause of preventable severe liver disease. If you have liver concerns, this is the first risk factor your doctor will address. Number 2. Sugar-sweetened beverages and excess added fructose. Think sodas, powdered fruit drinks, many store-bought iced teas, and processed foods that use high fructose corn syrup. Unlike glucose, which the body broadly metabolizes, fructose is primarily handled by the liver. When the liver is repeatedly exposed to large fructose loads, it ramps up de novo lipogenesis, the process of converting sugar into fat. Over time, that increases triglyceride storage inside liver cells, promoting non-alcoholic fatty liver disease, NAFLD, and inflammation. Large observational studies and controlled trials repeatedly show that reducing sugary drinks lowers liver fat and improves metabolic markers. The simplest, highest-impact dietary change for many patients is eliminating sweetened beverages. Number 3, industrial trans fats and ultra-processed foods. These foods hide in packaged snack cakes, many commercially fried products, and cheap margarine-like spreads. Industrial trans fats, partially hydrogenated oils, promote systemic inflammation, insulin resistance, and visceral fat, all drivers of liver fat accumulation. Ultra-processed foods compound the problem. They often combine refined flours, added sugars, unstable fats, and additives that create a metabolic triple threat. Even though many countries have reduced industrial trans fats in the food supply, ultra-processed products still flood diets and correlate with higher rates of metabolic disease and NAFLD. Number 4, unregulated or high-dose herbal supplements. This category surprises people because natural is often equated with safe, but concentrated botanical extracts have caused documented cases of acute liver injury. Examples reported in clinical registries include high-dose green tea extract, kava, certain weight loss blends, and contaminated herbal mixtures. These adverse events are often idiosyncratic and unpredictable, yet they can be severe. Unlike prescription medications, many supplements lack rigorous pre-market safety testing and quality control, so contamination, variable dosing, and interactions are real hazards. If you take any supplement, especially for weight loss or metabolic boosting, tell your clinician. Number 5, frequent consumption of processed meats and diets very high in saturated fat and heat-created byproducts. Processed meats, bacon, sausages, deli meats, and diets that rely heavily on fried and charred red meat expose the body to nitrates, nitrites, polycyclic aromatic hydrocarbons, and other compounds linked to inflammation and carcinogenesis. Epidemiological studies link processed meat-heavy patterns to worse metabolic health and elevated long-term risks for some liver cancers in susceptible populations. When combined with low fiber intake and high refined carbohydrate consumption, these dietary patterns push metabolism toward liver fat accumulation. Those are the 5 categories clinicians commonly emphasize: alcohol, excess added fructose or sugary beverages, industrial trans fats and ultra-processed foods, risky herbal supplements, and processed meat-heavy, high-saturated fat diets. Now, let's be practical and explain how they damage the liver, briefly and in plain terms. Alcohol metabolism produces toxic intermediates that directly damage cells and trigger inflammation. Fructose overload stimulates the liver to make fat. Industrial trans fats and refined carbs breed insulin resistance, which impairs the liver's ability to regulate fat and glucose, favoring fat storage. Certain supplements contain concentrated phytochemicals or contaminants that provoke immune or toxic reactions. Processed meats and high-temperature cooking create compounds that increase oxidative stress and inflammatory signaling. All these pathways converge on the same outcomes: fat accumulation in liver cells, chronic inflammation, scar formation, and in advanced cases, cirrhosis or cancer. So, what should you do today? Here are evidence-based, clinician-approved swaps and habits that produce measurable benefits. First, cut sugar-sweetened beverages. This is low-hanging fruit. Replace sodas and sweetened fruit drinks with water, sparkling water with citrus, or unsweetened tea. If you crave fruit flavor, eat whole fruit instead of drinking juice. The fiber slows sugar absorption and reduces hepatic fructose load. Second, reassess alcohol. The safest path for liver health is abstinence or very low consumption, especially in people with diagnosed liver disease or metabolic risk factors. If you choose to drink, discuss individualized limits with your healthcare provider and avoid binge drinking patterns. Third, minimize ultra-processed foods and industrial trans fats. Cook more at home using whole ingredients and stable oils like extra virgin olive oil or avocado oil. Read labels. If you see partially hydrogenated oils, put it back on the shelf. Replace packaged pastries and fried snacks with fruit, nuts, yogurt, or whole grain options. Fourth, be cautious with supplements. Don't assume natural means harmless. Ask your clinician before starting any extract or concentrated botanical, especially if it promises rapid weight loss or dramatic metabolic effects. Check credible resources like Liver Talks or professional guidance for known hepatotoxic agents. Fifth, moderate processed meats and favor lean proteins and plant-based sources. Choose fatty fish, legumes, nuts and seeds, and modest portions of lean poultry. Include fiber with every meal. Vegetables, legumes, and whole grains change metabolic context and reduce liver fat deposition. Many viewers ask, what about natural remedies and supplements that might help the liver? There are several compounds with growing evidence, but each requires nuance, careful dosing, and medical oversight. Milk thistle, Silybum marianum, whose active complex is silymarin, has been evaluated in multiple randomized trials and systematic reviews. Some studies report improvements in liver enzyme tests and symptoms in people with fatty liver, but the literature is heterogeneous. Results vary by formulation, dose, and study quality. It's a plausible adjunct, but not a standalone cure. Curcumin, the bioactive compound in turmeric, shows promise in randomized trials for improving liver enzymes and metabolic markers in patients with fatty liver. Again, trial quality and formulations differ, and curcumin's bioavailability is an issue unless given in enhanced formulations. Discuss dosing and interactions with a clinician. Omega-3 fatty acids, EPA and DHA, have been tested in multiple trials with mixed but sometimes favorable effects on liver fat and lipid profiles. They are generally safe and can be a reasonable adjunct, particularly in patients with high triglycerides, but they are not an instant fix. Probiotics and symbiotics, targeted modulation of the gut microbiome, have shown encouraging signals in meta-analyses for improving liver enzyme levels and some markers of steatosis. The microbiome is a promising avenue, but clinical protocols vary and specific strains and doses matter. Coffee consumption, in moderate amounts, is associated in observational studies with lower risk of fibrosis progression and better long-term liver outcomes in populations. That's not a license to rely on coffee alone, but regular coffee intake is one of the most consistently observed protective patterns across populations. A crucial safety note: some botanicals and high-dose extracts have been implicated in liver injury. High-dose green tea extract, kava, and several adulterated weight loss products have produced acute hepatitis in case reports. The distinction is important. Culinary use of tea or turmeric is generally safe for most people. Unregulated concentrated extracts can be risky. Always consult a clinician and use reputable brands if you consider supplements. If you have risk factors, obesity, type 2 diabetes, metabolic syndrome, high triglycerides, heavy alcohol use, or family history of liver disease, talk to your healthcare provider about screening. Common tests include liver enzyme panels, ALT, AST, imaging such as ultrasound or fibroscan for liver stiffness, and targeted blood work. Early detection matters because lifestyle changes have the greatest effect before advanced fibrosis develops. If this video was helpful, please hit like and subscribe. I publish evidence-based, clinician-friendly health guides each week. In the comments, tell me which of these 5 surprised you most, or type supplements if you want a deep dive episode focused only on dosing, safety, and the best studied formulations. I'll pin the most thoughtful question and include curated references in the video description.
Did you enjoy the video? Subscribe to our channel, Health and Wellness for All, for more tips and information. See you soon.